Welcome to Adventist HealthCare and You, the new podcast from Adventist HealthCare. My name is Shanna and Nimeet. I'm in the Public Relations and Marketing Department, and we wanted to take this time to introduce the community to our new podcast. So a little bit about myself is I've been with Adventist HealthCare a little over 8 years. I feel like the last 2 years have been 50 years under COVID, but we're making it through, and I'm 40. I have a little boy. He's 7, and I'm married. So that takes up a lot of time too, along with being a working mom. But I really enjoy it here and what we bring to the community. So it's been really nice to be a part of this culture, a part of this company and this organization for as long as I've been here. So Nimeet Kapoor is with us too. He's going to be my co-host. So I'm going to have him introduce himself a little bit.
Thank you, Shanna. So as Shanna said, my name is Nimeet Kapoor. My background was from nursing. I joined the Adventist HealthCare team a little about 2 years ago. I was the nurse manager for the ICU and their rapid response team. So during the pandemic, I was fortunate enough to have a team that really helped us gain some resources and techniques for the society and community to ensure that we had everything that we needed. So it was quite a journey. And as Shanna mentioned, that we got experience of 5 to 10 years in a matter of months. So that was very challenging, but we also had some great days as well. I'm glad we had some end in sight at this point, and we are looking forward to connect with our community.
Thank you. I can't imagine being in your shoes these last almost 18 months, almost 2 years. So we really thank you for what you've been doing for the community and for our organization, our patients.
And we work as a team.
That's right. Yes, we do. I'm not clinical, but I've been in healthcare for over 20 years at this point. But I do feel like I've made a turning point in my own health. Once I turned 40, I need all of these new screenings. I need my mammogram. I have to think differently about my health now. So that's really what we want to do with this podcast, is talk to the community about their health, the topics they want to hear about in a really easy, accessible way. Healthcare is hard. And so we really want to be here for the community with our experts and others to help you.
I think one of the things that I do want to connect with the community is just talking about the basics, right? And hopefully answering some of the questions that the community may be having in layman's terms.
Yeah.
And this is how we could better navigate the system. Healthcare system is always challenging to navigate, and nobody likes to come to a hospital, but we don't make sure when people do come to the hospital, they get the best care. But how do we ask the right questions, when to ask the right questions, or who to ask that to?
Yeah.
So those are some of the things I'm looking forward to discuss in the future.
Yeah. No topic I think is going to be off limits.
Yeah.
Maybe some, who knows? But, we really, like I said, we want to cover topics that, the community wants to hear and cover them in a way that is understandable and helps people. Our first episode is going to be on a healthcare reset. We're all, I think, thinking about our health a little differently. As you said, all these new terms came into our vocabulary 18 months ago. So how do we think about our health differently now? What's going on? And how can we kind of enter in this next phase of COVID and take our health seriously and different moving forward? So, and then we can talk about stress, mental health. That's always a big topic. So I think we'll talk about a lot of things here. So thank you for doing this with me, Nimeet. I've been wanting to do this for a while. And so it feels good that we're going to get started and try to connect with our community in a different way.
Yeah, no, thanks for having me as a co-host. I'm very excited for this. I'm very excited to talk to the community and have them ask questions to us that hopefully we can answer.
Yeah, absolutely. We'll definitely be seeking the community's input. So stay tuned to our first official episode. We'll be talking about sort of, like I said, a healthcare reset, and make sure to follow us, subscribe to us so that you can get our new episodes. I think we're going to try to put out 1 to 2 a month. So stay tuned, and thank you.
Thank you.